Ms. Porter of California are permitted to participate in today's hearing. Members who sit on the subcommittee and are present shall have first priority to ask questions, followed by members who sit on the full committee and are present, and only after all committee members who are present have gone shall members who are not on the Committee on Education and Labor can ask questions. Subcommittee is meeting today in a legislative hearing to hear testimony on balancing work, health, and family, the case for expanding the Family and Medical Leave Act. Pursuant to Committee Rule 7C, opening statements are limited to the chair and the ranking member. This allows us to hear from our witnesses sooner and provides all members with adequate time to ask questions. I recognize myself now for the purpose of making an opening statement. Today, we're gathered to discuss our responsibility to ensure that all workers have the right to comprehensive family and medical leave to care for themselves and their loved ones. Working people should be able to contribute to the economy, knowing that if personal health or family caregiving needs demand it, they can take leave from work without losing their jobs or facing financial ruin. This means comprehensive federal family and medical leave policy must ensure leave is guaranteed, job protected, and paid. In 1993, Congress took an important step toward guaranteeing that workers the right to family and medical leave when it passed the Family and Medical Leave Act, or FMLA. Over the past 27 years, this law has enabled millions of workers to take unpaid time off to care for themselves and their families. Unfortunately, 27 years later, we failed to build upon that legislation. Although a patchwork of states have expanded paid and unpaid leave laws, federal law leaves millions of workers either without the right to take unpaid family and medical leave under the FMLA or unable to afford unpaid leave when they are eligible. Workers are often excluded from the FMLA by requirements that restricts which employers are covered, who's eligible to take leave, for whom workers can take leave, and the reasons for which workers can take leave. To be eligible for FMLA leave, an individual must work for a covered employer who've worked for that employer for 12 months and also have worked for 1,250 hours in the year before taking leave. And these restrictions leave out 44% of private sector workers, or 49 million workers from the FMLA. A large share of the workers left out are low-income workers, working parents, and workers of color. Even if a worker can take FMLA leave, federal law does not guarantee that a worker can take leave to care for family members in a way that reflects today's caregiving responsibilities and family compositions. For example, siblings, LGBTQ couples, domestic partners, and the millions of grandparents exclusively raising their grandchildren face a patchwork of policies that allow them to take leave in some states, but not in others. Moreover, even if a worker is eligible for FMLA leave and is a caregiver under the law's definition of family, they may still be excluded because of their reason for seeking leave. So while the FMLA covers parental and serious health needs, it does not cover other reasons for leave, including parents taking time to be more involved in their children's schooling, individuals donating their organs to save lives, or parents taking time to grieve a child's death. Finally, if working people have the right to unpaid leave under the FMLA, currently most workers cannot afford to forego wages to take unpaid FMLA leave. Nearly half of those eligible for unpaid FMLA leave cannot afford to take it, and nearly 2/3 of those who can still report financial difficulties. All of these barriers add up to fewer workers actually able to exercise their right to take the leave they've earned. For families, paid family and medical leave means improved maternal and infant health, as well as better long-term outcomes for children and mothers. For businesses, it means stronger work recruitment, increased employer loyalty, and reduced employee turnover. And for the economy, which currently loses $22.5 billion in wages each year because of inaccessible paid leave, it means more money in the pockets of American consumers and a reduced need for public assistance. S&P Global estimates that if women entered the workforce at the same rate as Norway, a country with a generous paid family and medical leave policy, the U.S. economy would be $1.6 trillion larger. Congress has the power to remedy this. Today, we will discuss how we can build on the promise of the FMLA. We will discuss how to expand who's eligible for FMLA leave by reducing or eliminating the law's 50-employee threshold, its 12-month tenure requirement, its hours worked requirement, and eliminating its marriage penalty. We will learn about proposals to update for whom workers can take leave and the reasons for which leave would be permissible under the FMLA. These proposals include H.R. 5456, the Family Medical Leave Modernization Act, which would expand the FMLA's range of recognized family caregiving relationships, the Family Leave for Parental Involvement in Education Act, which would allow parents and grandparents to use the FMLA to attend their children's educational activities. H.R. 983, the Parental Bereavement Act, which would add the death of a child as an allowable use of the FMLA leave, and H.R. 1224, the Living Donor Protection Act, which would include living organ donations as a serious health condition under the FMLA. In addition, we will also discuss H.R. 1185, the Family Act, which provides wage replacement for all workers so they can remain financially stable while on leave. And at the end of the day, this hearing is about making sure that we leave here dedicated to the cause of ensuring guaranteed, job-protected, paid leave for all workers. This is about ensuring working people can sustain their careers and livelihoods while giving workers and their loved ones the care needed to thrive. Thank you, and now I yield to the ranking member, Mr. Klein, for an opening statement.
I thank the chair, and I thank our witnesses for being here. Balancing a career and a family can be a challenge for many workers, especially when life-altering events like the birth or adoption of a new child or a serious illness occur. Allowing workers to take time away from their jobs during these moments ensures that these employees can remain in the workforce. Committee Republicans recognize the benefits provided by the Family and Medical Leave Act, which requires employers to provide up to 12 weeks of unpaid job-protected family and medical leave to eligible employees. Furthermore, Republicans in Congress have encouraged workplace flexibility and support for working families through the Paid Family and Medical Leave Tax Credit, which rewards businesses that provide paid leave benefits and allowing new parents to borrow from their private retirement account following the birth or adoption of a child free from penalty. While the FMLA has helped many workers balance work and family, there are an ever-growing number of employer-provided options that Congress should continue to recognize. In fact, many businesses already provide robust leave options for their employees to help ensure a positive and productive workplace. Family-friendly policies have become an important tool for companies to attract and retain quality employees in our competitive job market. According to the Society for Human Resource Management, the percentage of firms offering paid maternity leave nearly tripled between 2014 and 2018. The Bureau of Labor Statistics reported that 66% of wage and salary workers had access to paid leave in 2018, up from 60% in 2011. Companies know they need to understand their current and prospective employees' workplace concerns and be prepared to address them. Congress should allow our nation's employers the flexibility to develop and offer personalized solutions that work best for their employees and themselves. As this committee examines the issue of family and medical leave, we should avoid implementing one-size-fits-all solutions and instead focus on how we can foster an environment that encourages employers to meet the needs of their workers. Take the Tax Cuts and Jobs Act, for example. The 2017 pro-growth, pro-worker tax reform passed by Republicans and signed into law by President Trump included a tax credit for employers who voluntarily offer at least 2 weeks of paid family and medical leave to their employees, which is set to expire at the end of this year. This allows employers to claim a tax credit for up to 25% of the amount of wages paid to qualified employees taking between 2 and 12 weeks of paid family and medical leave. Another Republican-led initiative, H.R. 5656, the Working Families Flexibility Act, amends the Fair Labor Standards Act to allow private sector employers to offer their employees the choice of paid or comp time in lieu of cash wages for working overtime. This provides hourly workers the choice to access additional paid leave options not currently available to them. The Working Families Flexibility Act passed the House in the 115th Congress. These initiatives help create solutions for working individuals and families without burdening the American taxpayer and without creating new burdens on employers. Unfortunately, many of my colleagues' initiatives on the other side that we'll hear about today have a different approach, with overarching government involvement and a hefty price tag for workers and employers. The bottom line is that Congress should avoid burdening the American taxpayer and employers through additional Washington knows best federal mandates when the private sector is already innovating solutions that create workplace flexibility for employees. I look forward to hearing from our witnesses today about how the federal government can continue encouraging employers to develop solutions that meet the needs of workers and their families. Thank you, Madam Chair.
Thank you. Thank you. Without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on February 24th, 2020. I will now introduce our witnesses. Representative Sidney Batch represents District 37 in the North Carolina House of Representatives, which encompasses Holly Springs, Apex, Fuquay, Farina, Garner, and Angier. Representative Batch is also a family law attorney, child welfare advocate, and social worker. She lives in Holly Springs with her husband and 2 sons. Mr. Tony Sandkamp is the owner of Sandkamp Woodworks, LLC, a small independent custom architectural woodworking business. The business has been based in Jersey City, New Jersey for the past 23 years. Mr. Sandkamp is a leader with the Main Street Alliance of New Jersey, a statewide network of small business owners. Ms. Rachel Gressler, is a research fellow in economics, budgets, and entitlements at the Heritage Foundation. Ms. Gressler provides research and commentary on workplace issues, including federal employee compensation, women's issues and labor policies, such as minimum wage and paid family leave. Dr. Elizabeth Jacobs is a senior fellow at the Urban Institute, focusing on issues related to family economic security and economic mobility. Dr. Jacobs is a nationally recognized expert on family income and earnings instability, low-wage employment, and job quality, intergenerational mobility, and opportunity, as well as a wide range of related policies, including social insurance, labor market regulations, and safety net policies. Thank you all very much for being here. We appreciate all of the witnesses. We look forward to your testimony today, but let me remind the witnesses that we will have read your written statements and they will appear in full in the hearing record. Pursuant to Committee Rule 7D and committee practice, each of you is asked to limit your oral presentation to a 5-minute summary of your written statement. And let me remind the witnesses that pursuant to Title 18 of the U.S. Code, Section 1001, it is illegal to knowingly and willfully falsify any statement, representation, writing, document, or material fact presented to Congress, or otherwise conceal or cover up a material fact. So before you begin your testimony, please remember to press the button on the microphone in front of you so that it will turn on and the members can hear you. As you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow to signal that you have 1 minute remaining. And when the light turns red, your 5 minutes have expired, and we ask that you please wrap up at that time. So we'll let the entire panel make their presentations before we move to member questions. When answering a question, please remember to once again turn your microphone on. First, I'd like to recognize Representative Batch.
Thank you. Good afternoon, Chairwoman Adams, Ranking Member Klein, and members of the subcommittee. I'm Sydney Batch, a state representative in the North Carolina House representing Southern Wake County, an attorney, a part owner of a small law firm, a breast cancer survivor, the mother of 2 fantastic sons, and a member of Moms Rising. I'm here today because I've needed family and medical leave during the happiest and hardest times in my life. I know from personal experience how important family and medical leave is to my employees and constituents, to small businesses like mine, and to my community and state. I know how badly our country needs a comprehensive family and medical leave plan that ensures all employees have the right to take leave and return to their same or similar job, and one that provides wage replacement during leave. We don't have that today. For 27 years, the Family and Medical Leave Act has helped working families and people take unpaid leave, but it has its limitations. It exempts small businesses, employees who have been at their jobs for less than a year, and many part-time workers, and it also uses a narrow definition of family. I encourage you to expand the FMLA to address those problems, and I urge you to enact national paid leave insurance. Because the law firm my husband, business partner, and I own has 8 employees, we're not covered by FMLA. I had the flexibility to take 3 months of leave and maintain my health insurance when my sons were born because I'm a business owner, but few people can do that. While my unpaid leave created financial stress for my family, I didn't have the stress of worrying whether my job would be there when I was ready to return to work because I'm a part owner of the firm. Everyone deserves that same type of job protection. What is the purpose of being able to take paid family leave if your job isn't protected? Or of having job protection if you can't pay your bills while on leave? We need expanded FMLA protections and a paid leave insurance plan. I was diagnosed with breast cancer in 2018. I had a mastectomy on a Friday, and my husband returned back to work on the following Monday. In 2019, I needed a second mastectomy and reconstructive surgery. I had 3 surgeries and radiation treatment in 1 year. And that was while I was caring for my 6- and 8-year-old sons, working full-time at my firm, and serving in the North Carolina House. My mother, sisters, grandmother, and friends cared for me when they could negotiate time off, but their leave was not covered because FMLA does not include siblings or care for adult children. It should be expanded to cover leave taken by more relatives, domestic partners, and people who aren't blood relatives. And many fellow North Carolinians have suffered without adequate leave as well. For instance, Jonathan in Wilmington, who didn't have FMLA coverage when his sibling, who lives 400 miles away, was dying of bladder cancer. And Meryl in Weaverville, whose father lost his job and parents had to sell their home after her father took earned time off to care for her mother, who had a stroke. Job protection and paid leave would have protected his job and their home. Studies, in my own experience, show it's good for employees and businesses when workers can hold on to their jobs while caring for their families or recovering from an illness. I strongly support Representative Carolyn Maloney's FMLA Modernization Act. Lack of job protection is a major barrier that prevents working people from taking leave. Ensuring that all workers, including those at small businesses, those who work part-time, and those who are recent hires, have job protection through the FMLA is essential. Another tremendous barrier to taking leave is lack of wage replacement. The Family Act is the best paid family and medical insurance leave bill. Its passage is a priority for families and small businesses, and it should be for Congress. I'm proud to co-sponsor a paid family and medical leave insurance bill in North Carolina. It shares costs between the employer and the employee, and covers small businesses and people who are self-employed. It also uses an inclusive definition of family, provides job protection, and addresses the needs of military families. I will continue to fight for it, but people in every state need paid leave insurance, so action by Congress is essential. Please expand the Family and Medical Leave Act protections so more people can access the unpaid leave and job protection it provides, so it no longer exempts small businesses, employees who are new to their jobs, and part-time workers. And so it uses an inclusive definition of family. And I hope that you will pass the Family Act as well. When you do both, we will have the comprehensive medical and family leave coverage everyone in America deserves. Thank you.
Mr. Sandkamp, you have 5 minutes.
Chairwoman Adams, Ranking Member Klein, and members of the Subcommittee on Workforce Protections. My name is Tony Sandkamp, and I started my business, Sandkamp Woodworks, in 1991. My 4 full-time employees and I provide custom cabinetry and architectural woodwork from my shop in Jersey City, New Jersey. I'm a member of the Main Street Alliance, a national network of more than 30,000 small business owners. This past week, we celebrated the Family and Medical Leave Act's 27th anniversary, which allows millions of eligible American workers to take job-protected leave. While this was landmark legislation in 1993, the FMLA leaves out over 44% of American workers. It's past time for Congress to update the family and medical leave protections to better address the needs of today's workforce. Today, I'd like to address several issues as they relate to family and medical paid leave and the importance of having a good program in place. Family and medical leave programs should have a modernized 21st century definition of family. To be effective, paid leave must include job protections. And small business owners overwhelmingly support and need Congress to take action to pass paid leave. As a small business owner based in New Jersey, I have a before and after experience to share about what happens when paid leave is available to small business. And as a family member, I have a personal experience to share about family definition. 3 years ago, my sister in Minnesota received a diagnosis of stomach cancer. Luckily for our other sister, Rose, who lived nearby, who was not working at the time, was able to care for our ill sister for 4 months. Our parents were elderly and they could not care for her. And if it had not been for Rose, I don't know what we would have done. If Rose hadn't been working, her job would have been at risk, as the FMLA does not include siblings in their family definition. For far too many other families, caring for a loved one in their time of need means putting their job on the line. New Jersey provides a great example of what can be done. Last year, the New Jersey legislature updated the definition of a family member in the state's family leave program to include siblings, grandparents, grandchildren, and close associations that are the equivalent of a family relationship. This is particularly important to the LGBTQ community and employees who have disabilities, as they're especially dependent on care by chosen family members. I want any of my employees, no matter who they love or deem as a family member, to be able to take the time they need to care for a loved one. New Jersey also expanded job protection and increased wage replacement, so more workers could afford to use the family and medical leave benefit. Without job protection, paid leave can just end up being severance pay. Ensuring that employees can go out on leave and know that their jobs will be there when they return is a necessary component of any leave program. Strong job protection ensures that all companies do the right thing so that high-road businesses like mine are not at a competitive disadvantage. Most significantly, small businesses and our employees need access to a paid leave program. Small firms lack the capital and scale to provide paid leave. The lack of a national paid leave program hands the advantage to large corporations that can use their size and market power to offer such benefits, resulting in a hiring disadvantage for small business. We can change this picture. Before New Jersey adopted paid leave, I had an employee who left my company to care for his dying mother in Florida. He was her only family, and he needed leave to provide care for her. He didn't tell me why he was leaving, But even if he had, my business could not have covered his salary and the additional cost of a replacement worker. If New Jersey had family leave insurance available during this time, we would have avoided the pain and damage that occurred to both my employee and my business. He would have had the opportunity to take paid leave without feeling like he was asking me for a personal favor, and my business would have retained a valuable employee. But the state of New Jersey did not have a paid leave program yet, and my business paid the price. This employee was one of the best performers on our team. The cost in time and money to replace him were astronomical. Replacing employees is expensive, with turnover costs averaging 1/5 of an employee's annual salary. Now for the after picture. 4 years later, an employee came to me and informed me that his wife was pregnant with twins. He needed paid time off, and I had recently joined the Main Street Alliance and learned about the New Jersey Family Leave Insurance Program. The paperwork was straightforward, and I worked with my employee to ensure that it was completed. The program provided him with wage replacement while he was bonding with his twins. The plan we created for him to take time off was inclusive of my entire team taking part. I had the funds to pay for a part-time employee to move to full-time, and my employee had the time off he needed, and he came back after leave and remains a valuable part of my team. A national paid leave program that covers all of us, pools our funds, and spreads cost will be a tremendous benefit and a huge relief for small business. This is why a federal leave program is supported by 70% of small businesses by one recent survey, and we need Congress to act. I look forward to working with this committee and small business owners from across the country to move the family and medical paid leave across the finish line.
Thank you, Mr. Sandkamp.
Thank you.
Gressler, you have 5 minutes, ma'am.
Thank you for the opportunity to be here this afternoon. As a mother of 6 young children and having close family members who have experienced serious medical conditions recently, I understand the need for workers to be able to take leave. And I also understand the need for that leave to be flexible and accommodating. Flexibility is actually what workers want most. A recent Cato poll asked workers, what would help you balance your work and family needs the most? And according to that poll, 6% of people said more paid parental leave. Compared to that, 6 times as many people, 34%, said that they wanted more workplace flexibility. Unfortunately, the FMLA and other regulations that put politicians and bureaucrats in charge of decisions like who qualifies to take leave and how and when they can take that, they end up limiting the ability for workers and employers to sit down together and to figure out leave plans that balance both of their needs. For example, a Harvard study that was looking at the wage gap revealed that 45% of all workers at a local transportation authority in Massachusetts had FMLA certifications. It's really difficult as an employer to be able to offer flexibility to your employees if on any given day, half of them might not be showing up for work. And despite that desire for flexibility, the House passed a bill last week, the PRO Act, that would destroy flexible work options, telling workers who want to be their own bosses that they must instead answer to a boss or else form their own corporation. The majority of workers do support a federal paid family and medical leave program, but that support plummets when they're faced with the actual costs. And the reality is, paid family and medical leave can't be free. So long as workers are providing value to their employers, there's going to be costs and consequences from them not being there. And a government program can't erase those costs, it can only redistribute them. It turns out that government programs across the world and in the US do a really bad job at redistribution. They end up shifting resources away from lower income workers and families to middle and upper income ones. In California, 5 times as many workers in the highest income bracket filed paid family leave claims compared to those in the lowest bracket. Canada's program is said to exacerbate class inequality and, quote, aid the social reproduction of higher income families. Both Norway and San Francisco expanded their programs trying to attempt to remedy this redistribution, and yet low-income mothers in San Francisco were still half as likely as those in the highest income levels to take paid leave from the state. And in Norway, the expansion was, quote, costly, had no measurable effect on outcomes, and poor redistribution properties. Meanwhile, in the US, we have a number of large employers, companies like Starbucks, Lowe's, Target, Walmart, that have all expanded new paid family leave policies for these lower wage workers. Government programs also have unintended consequences for women. In California and New Jersey, their programs resulted in higher unemployment rates and increased the unemployment duration for young women. And in California, the program resulted in 7% lower employment and 8% lower annual earnings for the mothers who used it. Across the world, these programs also lead to fewer promotions for women. That's important because according to that Cato poll, only 29% of workers supported a federal program if it meant fewer benefits for them or fewer chances of promotions for women. Another factor that reduced worker support was tax increases. A cup of coffee a week program, such as the Family Act, would only finance a tiny fraction of the leaves that workers actually want to take. More realistic estimates peg the price tag at an extra $1,500 to $2,900 per worker. Most families can't afford to give up 1 or 2 mortgage payments a year. What I think we all want is common sense and compassionate paid leave policies. Most employers do have compassion for their workers, and even those who don't have the common sense to know that they risk losing their workers if they refuse to help meet their needs. The best solution that we can offer workers who face unreasonable employers is a strong economy with plentiful job opportunities. But the more rules and regulations that the government imposes, the fewer workers businesses will employ, and the fewer benefits and the less flexibility that they will offer them. As a working mom, I know the value of flexibility, and I urge you all to enact policies that will add flexibility instead of take it away. The Working Families Flexibility Act, for example, would give lower-income hourly workers the choice to accumulate paid leave in exchange for overtime work, and universal savings accounts and increasing private disability insurance coverage would help workers and families balance their needs. Thank you.
Thank you. Dr. Jacobs, you have 5 minutes.
Thank you, Chair Adams, Ranking Member Klein, and members of the subcommittee. I am pleased to be here today to address an important topic for workers, families, and our economy as a whole: the role that family medical leave plays in supporting the millions of Americans balancing work and caregiving responsibilities. And I'll note that the views I express today are my own and should not be attributed to the Urban Institute, its trustees, or its funders. My testimony draws 4 main conclusions. First, the historic passage of the FMLA in 1993 has had important positive effects for families and workers with minimal evidence of negative consequences for business or economic growth. However, family earnings dynamics, caregiving needs, and the structure of the labor market have evolved in the past quarter century. For example, women now play an equally important role as family breadwinners as they do as family caregivers. Indeed, 41% of mothers were the sole or primary earners for their families, earning at least half of their household's total earnings. Family caregiving needs extend beyond parents caring for a new baby, especially as America ages. The sheer number of baby boomers means that the number of elderly individuals grows annually, and the fastest growing group of older adults are those 80 and older. The structure of work is shifting. While it's still a relatively small share of the overall labor force, alternative work arrangements accounted for 94% of employment growth between 2005 and 2014. Second, FMLA provides important protections for families balancing work and care responsibilities, but the most economically vulnerable workers too often are excluded from accessing those rights. More than 14 million workers took FMLA leaves in 2012, the most recent year for which we have available data from the BLS. However, many more workers are unable to take leave for family or medical reasons without risking job loss. 44% of the workforce is not covered by the FMLA. And there are substantial demographic disparities in worker access to FMLA-protected leave. For example, 42.6% of working women of childbearing age are not eligible for FMLA protection. Less than half of all workers living in families with incomes under $40,000 are FMLA eligible, and Hispanic and non-white workers are less likely than white workers to be FMLA eligible. Given FMLA's limits, it's not surprising that unmet demand for needed leave is high. 16% of workers report a time when they needed to take time off for an FMLA qualifying reason but were unable to do so. And nearly a third of workers in low-income households were not able to take a needed leave. Third, modernizing the FMLA to reflect contemporary work and family would expand access to needed leave for millions of workers. For instance, FMLA excludes part-time workers, including those who work a full-time schedule split across multiple employers. Updating FMLA to protect part-time workers could help millions of families. FMLA's definition of family is limited and as such does not include the most important caregiving relationships for many workers. For example, FMLA doesn't offer protection for grandparent caregivers. We know that nearly 1 million grandparents serve as their grandchildren's primary caregiver, and over half of these grandparents were in the labor force. Updating the definition of covered family to reflect the multi-generational households of contemporary America would expand access to leave. Fourth, job protection is one of a number of important policy elements that Congress should consider. Wage replacement is another. A growing number of states have implemented paid leave programs that allow workers to earn paid time off for parental, family, and medical leave. All of these state programs use a social insurance model with leaves funded by a very small payroll contribution. And many of those states have combined those paid parental leave policies with rights to job protection that go beyond those provided by federal law and provide medical and caregiving leave as well. Evidence tells us that these policies can have wide-ranging positive impacts on child and adult health, as well as on earnings and employment outcomes for leave takers. Because labor force participation rates are a critical element of economic growth, policies like paid leave that boost labor force attachment are a macroeconomic growth strategy, as well as a support for working families. Businesses in states with paid family and medical leave programs in place view these policies favorably. Paid leave programs may also improve productivity by reducing turnover. The states have provided models for what works, but the evidence suggests that the time has come for updating federal policy to meet the challenges of a 21st century economy. A federal program with uniform eligibility requirements, protections, and benefit schedules would eliminate the unevenness between the states, create a level playing field for state finances, for employers, and for workers. A federally administered system coupled with federal protections would be substantially more efficient to administer than 50-plus separate state and local programs. In conclusion, the evidence tells us that working families are facing substantial challenges to combining their economic and caregiving responsibilities. But research also tells us that we have policy solutions available, solutions that work for families, for workers, for employers, and for the economy as a whole. Thank you.
Thank you very much. Thank you very much. Under Committee Rule A, we will now question witnesses under the 5-minute rule, alternating between the parties. I now recognize myself for 5 minutes. Dr. Jacobs, you mentioned in your testimony that economically vulnerable workers are too often excluded from the right to family and medical leave. I want to talk about some of the limitations in the FMLA that lead to this exclusion. Many wage workers work in industries with high turnover rates. How does this contribute to these workers being excluded from the right to FMLA leave?
Thank you for the question. FMLA requires workers to have at least a year, 50 weeks, of tenure with an employer to be eligible for FMLA-protected unpaid leave. And as a result, workers in industries with high turnover rates, like those that you mentioned, are less likely to be eligible for FMLA because they're more likely to have been on the job for less than a year when the need for leave arises. And we know that turnover rates are especially high in low-wage industries such as leisure and hospitality, retail. These are places with lower than average median wages, and they've also got very high turnover rates, so you have some of these most economically vulnerable workers who don't have job protection when they need to take time out of work to care for themselves or a family member.
Okay. Many workers struggle to get the hours that they need each week and may be involuntarily part-time or work part-time jobs for more than one employer to make ends meet. So how does this contribute to these workers being excluded from the right to FMLA leave?
So in addition to the year-long tenure requirement that we just talked about, the FMLA also requires that an employee have worked at least 1,250 hours per year, and that's about 25 hours per week on average, with a covered employer in order to have the right to unpaid leave. So this eligibility requirement means that many part-time workers are excluded. That includes workers who may be working a full-time schedule, patching together two different part-time jobs, but for multiple employers, because this requires them to have hours amassed with one employer.
Okay.
On top of that, we know that the share of workers who are working part-time for involuntary reasons, so that means folks who'd really like to be working a full-time job but just haven't been able to find one, that number remains elevated. It's above pre-recession rates. In other words, we know that more workers are stuck in these involuntary part-time jobs for longer periods in today's economy, and those workers are the folks who are excluded from FMLA protections.
Thank you. Representative Batch, you have a bill pending in the North Carolina House. I served there for 20 years, so I know I'm real familiar with them, that would create a state level family and medical leave insurance program in North Carolina. Given your efforts at the state level, why is it important that we at the federal level ensure that all workers have the right to take time off to care for a loved one and the ability to afford to take that time off?
That's an excellent question. One of the concerns and issues is that we live in a transient society. People move from state to state. And if we have protections that are only in North Carolina or only in Kentucky or only in California, those are the workers that are protected. However, we know that we have family members, including Mr. Sandkamp, who gave a perfect example of his sibling, who, if he had FMLA protections and paid insurance, he would be able to use that. But if we don't have a national program, individuals who live in other states would not be able to care for their loved ones, and that's one of the main reasons. I also think it's important for the federal government to create a clear baseline for protections, and states can do more if they choose to.
Thank you. Dr. Jacobs, what are the impacts of job-protected paid family and medical leave on maternal mortality rates, especially for working mothers of color?
So I can say something about the impact of job-protected leave on infant mortality rates, which we know has been substantial. And I can say that we know that job-protected leave has also provided mothers with the chance to actually go to more well baby visits, take care of themselves. It's reduced postpartum depression and allowed mothers to take better care of themselves, all of which I think it's reasonable to say connect to better women's health outcomes more generally.
Okay. I want to, I did have another question here. So why is it important, Representative Batch, that all workers, including your employees and constituents, have access to job-protected paid family and medical leave?
So I think that 12% of North Carolinians right now are currently covered by paid leave programs, but that leaves a significant and vast majority of North Carolinians without it. And so if you are putting in your sweat equity into businesses and, of course, contributing to society as a worker, you should have the ability to go ahead and actually have paid leave when you need it most. So I think it's essential that we take care of that now.
Thanks very much. I want to recognize the ranking member for the purpose of questioning the witnesses now. 5 minutes, sir.
Thank you, Madam Chair. Ms. Gressler, your testimony explains that with regard to federal paid leave programs or proposals, it's difficult to design a single program that can meet the needs of all the workers who require it without being so expansive as to invite misuse, abuse, and excessive costs. Does this rationale also apply to legislative proposals to expand the definitions and permissible use of leave under the Family and Medical Leave Act?
Yes, I do think it would make it more costly and burdensome. There are definitions that are not clearly defined. In current FMLA, a serious medical condition is not well defined, and employers have had employees report conditions such as a hurt toe or a migraine or a severe cough that ends up resulting in an FMLA certification. And if we add an additional uncertainty in there in terms of what is a close family-like relationship, this could end up being any leave for any reason, and then you prevent employers from being able to have those flexible policies. Most people would rather shoot an email or go and sit down and ask for their boss and tell them about what their circumstances, whether it's to attend a child's conference at school or whether it's a sick family member or maybe a sick non-relative. It's easier to have that conversation than it is to fill out the paperwork, go and get 1, 2, maybe 3 medical certifications, potentially have to challenge this. It's just easier for the employers to work directly with their employees.
And again, to Ms. Gressler, family-friendly policies like flexible work schedules and telework options have become an important tool for employers around the country to attract and retain quality employees. This is particularly true in more rural areas like many in my district. Such benefits have become more important as unemployment levels remain at record lows and businesses compete for talent. Simply put, it's a buyer's market for job seekers. How would government interference impact employer-provided benefits?
It would end up taking more away. I recently saw a survey about what are employers doing to attract employees when we have such low unemployment rates. And the highest thing they're doing, 44% of them are offering more flexible workplace policies because that's what workers want. When we start taking those away, they can't offer those. I had the opportunity to sit in with about 25 HR representatives, and they were all representing larger companies. And I said, well, if there weren't a state-based policy there, these were in states that had them, if that policy weren't there, would you provide less to your workers? And they all said, no, we would provide more because we wouldn't have to be spending so many of our resources and our employees wouldn't be spending so much time trying to figure out how they can comply with these laws. And they'd had cases where they'd told workers they could take leave and then it ended up they couldn't and they had to give their checks back. Or they had to dock FMLA down to every 3-minute increment. And this just prevents them from providing the flexibility and the benefits that they otherwise would offer those employees. I think, on a federal level here, it would ring true for all of you thinking about if you had to shift a lot of your budget to mandatory spending, you no longer have that discretionary spending and the resources to actually address the needs of your constituents because so much of it is tied up in what mandatory spending is telling you what you need to do.
Now, H.R. 1185, the Family Act, would impose new taxes on working families and job creators. Now, the proposal is to have a 0.4% payroll tax. And Mrs. Batch, you specifically endorsed 1185, so I'll ask you first. An analysis of this bill found that that 0.4% payroll tax would only cover 15% of the benefit payments, and that fully funding benefit payments would require a payroll tax as high as 2.9%. The Joint Committee on Taxation estimates that covering the true cost of the Family Act would require a payroll tax increase of between 2.7 and 3.1%. So would you not agree that that is a significant burden on employers to have to meet that hidden tax increase?
So I can't speak to the actual research. I know that what you just read, I'm more than happy to follow up later on with my response to that. But what I would say specifically is that in North Carolina, it's $2 from the proposal in the legislation that we have introduced is $2 per week from a paycheck of the employee and $2 from the employer. And so $104 a year as a small business owner right now would be nothing compared to the costs and the overturn and all of the other expenses that occur when I have an employee leave, frankly, their job earlier because they have all of the other issues that they need to address.
Ms. Gressler, from what we know of other federal programs, should American taxpayers be assured that Uncle Sam won't come asking for more of their paycheck? And can you respond to that analysis?
Yeah, well, I think we can look back at Social Security. When it first started, it cost 2% of payroll, and those lawmakers promised we will never take more than 6% of your paycheck. It's now 12.4%. It's actually costing 15.3%. And these proposals can start with taxes, and it's easy to specify what you're going to collect, but very quickly that's not enough. If you look at what the Family Act is collecting, this is basic math. Compared to what you would collect versus the leave that workers are already taking, some of that without pay, the Family Act could only finance between 3 and 5% of leaves. Well, 3 and 5% of workers could take leave, but we know that 16 to 24% of workers either do take leave or want to take leave in a given year. And so it's easy to see that that would not actually finance a program that would cover people's needs.
Thank you. Thank you, Madam Chair.
Ms. Jalapon, I recognize you. 5 minutes, ma'am.
Thank you, Madam Chair, and welcome to our witnesses. For years, I've heard from workers in my home state of Washington about why they need paid leave. Stories like Adriana, a home care worker who couldn't take leave from work when her mother was dying. Angela, who struggled to decide whether or not to go to a prenatal doctor's appointment or to save her very limited vacation days for after she gave birth. At the age of 33, with a 20-month-old, Jennifer, who needed paid leave so that she could get treatment for breast cancer. These stories were horrific, but now Washington state workers are breathing a sigh of relief. The state's comprehensive paid family and medical leave program went into effect this year, and under that state-paid family and medical leave program, almost every worker, regardless of the size of her workplace, can take paid leave. But unfortunately, many workers across the country can't enjoy these same benefits. And I wanted to focus particularly on those employers who have a limited number of employees, so small businesses. Dr. Jacobs, you mentioned in your testimony that many workers don't qualify for FMLA protections because their employer is too strong. As you know, workers don't qualify for FMLA unless they work for an employer with 50 or more employees in a 75-mile radius. How many workers would have the right to the FMLA's job-protected family and medical leave if Congress expanded the FMLA to cover small businesses?
Thank you for the question. It's a really important one, and I'm not aware of any published estimates on the number of workers who'd be eligible for FMLA leave if we lowered the threshold, the firm size requirement, but I do have preliminary estimates from Dr. Pamela Josie at Brandeis's Heller School for Public Policy and Management that unsurprisingly suggest that lowering firm size could substantially increase FMLA access. So her numbers suggest that 61% of the workforce would be covered by FMLA if firms with 10 or more workers were covered, were included under FMLA's threshold. I'll say that this is a good example of a space where we could use more research, in particular, on the various elements of job protection and of FMLA policy design to figure out exactly what would happen under each tweak, because there are a number of ways that we could change the policy, and figuring out exactly who it would impact and where would be a fantastic advance.
That sounds like a great thing to do, but I think we can probably agree that it would be millions more workers,
Yes.
correct?
Yes.
And if we had that, what are the benefits of ensuring that every worker has FMLA coverage? And can you speak specifically to women and the disproportionate burden that women have by these restrictions on small employers?
So I can't speak specifically to women in small employers, but I can say that we have lots of evidence on the cost of not having both job protection and paid leave for women, and on the benefits to having it. It's exciting that states like Washington have actually put policies in place. There are other states like California and New York and New Jersey, and a number of others that have policies on the way that have let us actually understand what happens over time. And we see, for example, in California that women's labor force attachment and employment has gone up. We see positive health outcomes. And we know that FMLA protections nationally cover a surprisingly limited number of women of childbearing age, and there's a whole bunch of reasons we could talk about as to why. They're typically young, they're newer in the workforce, we know that job turnover rates are high, we know that women are often concentrated in service, retail, these industries that, as we discussed earlier, have high turnover rates. These are all reasons why you have a certain segment of the population that may be disproportionately excluded, given how we set up the laws now. And we have state policies that show us that it doesn't have to be that way, and we can have positive outcomes that we're looking for.
Thank you. Mr. Sandkamp, you're the owner of a small business. How has New Jersey's paid leave insurance program increased your employees' economic security? And what's the benefit to you as an employer? We often hear that this is too costly and it hurts employers, but tell us what your experience has been in terms of retention and financial stability of your employees.
Thank you for the question. It's been incredibly positive for me. Like my example in my testimony, one of my employees whose wife had twins took paternal leave. He was able to get 6 weeks at that time, and now it's been expanded this year to 12 weeks of wage replacement, and it had time to bond with his twins and help his wife out before her mother was able to come and help her. For me as an employer, I haven't had a single employee leave for any reason like that since this act has been, since the family leave has been available in the state of New Jersey. And that is a huge cost savings for me as an employer, just in the terms of maintaining productivity and the cost to train a new employee to replace that employee that might have left.
Thank you, Madam Chair. My time has expired. I request unanimous consent to enter into the record a report, A Better Balance, entitled Paid Family and Medical Leave and Non-Standard Employees.
So ordered.
Thank you, Madam Chair. I yield back.
Thank you. Mr. Murphy, you recognize 5 minutes, sir.
Thank you, Madam Chair. Guys, thank you very much for coming today. This is obviously a big issue that faces us in the United States. I handled it personally on 2 different levels. One as a small business owner, employed, depending upon the year, anywhere from 40 to 50 employees, but then also just when I would take care of patients, oftentimes when they would try to take care of their mothers and, anybody else in their family who is operated on. So I'm not insensitive to the issue. I am concerned, as you said, Ms. Gretzler, about the unintended consequences of we start something and then it grows and then it grows and then it grows and it cripples small business. You mentioned that, as it is right now, it's proposed a 0.4% payroll tax. How do you envision that, given, the precedent that's been before with Social Security, et cetera? How do you envision that changing in the future, and how would that relate to small business, which is the predominant employer in the country? I see it, we want to do great things for our workers. We want to help them out, but it has to get paid for somehow. And how would that affect small business in this country?
Yeah, I think we can't avoid talking about the costs, even though it's something that we all want workers to have access to. And you start out small at 0.4%, and the other estimates have showed that it could be 2.9%. Well, how do we get there? We want a policy that will accommodate everybody, and it turns out that 66% of wages isn't enough. If you're making $15 an hour, you can't pay your bills on $396 a week instead of $600, so we increase the benefits to 100%. We expand who's covered. We increase the amount of time that you can take off. 12 weeks seems relatively generous in the U.S. today, but abroad it's 52 weeks, and so we expand it to that. And you just see the program grow and grow over time to try and meet everybody's needs. But as they're doing that, you also scoop in a lot of needs that weren't necessarily a need, but workers will take them because it's an entitlement. And we don't have the room right now to have another middle-class unfunded entitlement program in this country.
Thank you. I follow that argument, and having dealt with entitlement programs just in my business all the time, most folks are very good stewards of them, but unfortunately we do have fraud, waste, and abuse on many sides of the stream. Do you see anything in this particular effort that we can actually work to control these issues in the future? Because there will be people, just as you suggest, that said, hey, it's a free benefit, I'm going to take advantage of it. And unfortunately, those type of efforts hurt the people that they're meant to help.
Yeah, it is really unfortunate because Congress passed the FMLA with the intent to try and help workers who have serious health conditions and for them to be able to help their family workers. And in some instances, it's not all, but there are some out there where it's become a get-out-of-jail-free card. I was reading through some documentation. The Department of Labor had an opportunity for employers to submit comments, and I couldn't believe some of the cases where employees would get certified for FMLA for very minor conditions, and then they just use it whenever they want to. If it's, I'm 5 minutes late to work, and I don't want to be penalized for that. Some people have called it the Friday, Monday Leave Act, because it turns out that the most instances of family medical leave are taken on Fridays, on Mondays, the Monday after the Super Bowl, the first day of hunting season, and surrounding holidays. And so it is abused. It's really unfortunate, and that weakens the program for other people who really need to use it. And so there are extreme concerns if we're going to broaden the definitions further so that virtually anybody can take a leave, because we all have somebody that is a close friend or family member that has some type of medical situation going on. It creates an out for workers who don't want to do their duties at their job, and then that creates a more difficult situation for employers to provide the flexibility they really want to for the workers who need it.
I would agree completely. Thank you, Ms. Chairman. I'll yield back my time.
Thank you. I want to recognize the chair of the Committee on Education and Labor. Ms. Scott, you recognize 5 minutes, sir.
Thank you, Madam Chair. Dr. Jacobs, you mentioned, several mentioned that 44% of the public is not covered by family and medical leave right now, can't take it. Can you tell us what we need to do, what initiatives we should be looking at to increase the percentage of people covered?
So I think there are a number of different elements of policy design that you all could consider. First, you could consider expanding the share of covered employees. So for example, lowering the firm size requirements in order to cover a broader range of businesses. You could expand the number of eligible employees by considering lowering the job tenure requirements in order to include a larger share of employees, such as those with short job tenure, fewer hours worked. I will say that you could still have eligibility requirements that require a given level of labor force attachment. So this isn't just saying like you show up at work and it's your first time on the job and guess what, the next day you get leave. For example, like we do with Social Security, we can track people's employment and earnings over time, and it's not just tied to one employer, so you can have policies that are tied to labor force attachment and aren't just kind of a giveaway. You could expand the definition of family, as we've talked about earlier, consider leave taking for a broader range of family relationships, so grandparents, siblings. For example, the state of Oregon has a new policy that's about to go into effect, or they're working on it, that allows leave taking for any individual related by blood or affinity whose close association with the employee is the equivalent of a family relationship. So getting at what Mr. Sandkamp discussed earlier, kind of chosen family is incredibly important for certain populations. And then lastly, you could think about expanding the definition of leave, what is eligible for leave. So one example we haven't talked about yet, victims of sexual stalking, sexual violence, domestic violence. If you have a medical reason for leave that stems from one of those, then you may be covered. But the idea of needing to go to court, to move your location, there are lots of things that stem from those situations that actually we could cover under FMLA. We could also cover grieving for the loss of a loved one. And organ donation as well. So those are the number of dimensions that I think you've got a lot of space to move in.
Thank you. And you mentioned grandparents. Is that all grandparents or just custodial grandparents?
I think that's up to you. The numbers I mentioned are specifically for custodial grandparents, and half of them are working. But there are good reasons to think that, for example, a grandchild might be their closest kin to a grandparent who needs care. Right now, that working grandchild wouldn't be able to take care of their grandparent, even if there was no one else available to do it. And likewise, if you have a child who's not necessarily with a custodial grandparent, but the grandparent is the person best suited to provide care for that child, they have no right to FMLA-protected leave under the current law.
Thank you. Representative Batch, we're talking about who can get access to FMLA and also how to pay for it. Why is it important to deal with these policies both at the same time?
I think it's because most people aren't able to do one without the other. A lot of the families, as a family law attorney for the past 15 years, I see people at the worst time in their lives. And many of them are, frankly, at this point in time, dividing a lot of debt. They're worried about how they're going to still stay in their homes and take care of their children. And many workers just can't afford to take the time off, even if it's guaranteed, unless they have some wage replacement. So I think it's essential that we do both at the same time, because I had the luxury as a small business owner of taking that time off and knowing that my job was going to be protected, but I believe that every single worker in America deserves that same right.
Thank you. Ms. Gressler, you mentioned the Friday, Monday Leave Act. Do you have studies that show the days? Could you provide us with the studies that show the days people actually take off, or is that anecdotal?
I would refer you to some citations in my written testimony. I believe one was the Department of Labor statistics where employees were submitting things, and I can find it in there, but it was, some of it is anecdotal, but some of it you can actually track. At least each individual employer can track how long and when that leave is taking place, and one of those was a Massachusetts Bay Transportation Authority study that I cited, and I believe the rates of leave were at least 20% higher in the weeks when workers were scheduled a holiday shift or a weekend shift, and closer to 50% higher in the weeks that they were scheduled a holiday shift.
Thank you. Thank you, Madam Chair.
Thank you. Dr. Fox, you recognize 5 minutes.
Thank you, Madam Chairman. I thank our witnesses for being here today. Ms. Gressler, the bills we're discussing today substantially expand the categories of covered leave under the Family and Medical Leave Act, FMLA, distorting this carefully balanced law. This committee must carefully consider the additional burdens and practical compliance issues that these proposals place on employers and ultimately workers. Ms. Gressler, can you expand upon the potential compliance and regulatory burdens that expanding the FMLA would place on employers?
Yes, one of the examples I think of is my children's own daycare. And so this is a small business. They have about 10 teachers, 25 families there. if they have 2 workers that call out on one day for an FMLA reason and they didn't expect that, they have no way to replace them. Even when they do know in advance, it's really hard because those positions are skilled. They have to have appropriate hours of training. They have to have licensing. They have to have background checks. They can't get anyone in the door. And actually, we had a situation once where 2 people couldn't come in, and on a Friday, we were told the daycare was closed for the entire next week because they didn't have those 2 people there. So you had 25 families that were scrambling to find childcare. The more regulations we place, the more burdensome it is. And there's also the fact that if workers qualify under FMLA as opposed to just working a policy out with their employer, the employer is prohibited essentially from asking them to do any work. My own personal experience is that I have benefited from being able to do some work while I'm on leave at my own option, only what I want to do, but that's let me keep my foot in the door, and it's helped my employer for things not to be as disruptive, and that's something that FMLA prohibits.
Well, you note in your testimony that well-intentioned policies, like expanding the FMLA or implementing paid leave mandates, can have unintended consequences, as you're describing, especially for working women. So how have state-based leave mandates affected employment in those states? Should Congress expect different results in a one-size-fits-all federal program?
Yeah, I think, we're all trying to help workers, and especially women here, because we understand that they tend to be the primary caregivers. And the unfortunate consequence of some of these policies has been in states like California and New Jersey, younger women who are of childbearing age end up having lower rates of employment, higher durations of unemployment, and then a more recent study in California that used better IRS administrative data found that they had lower earnings and unemployment after using this. And so I think that we actually can expect to have higher unintended consequences with a federal policy, because that would be a bigger policy and it would cover more people, it'd be better known.
Thank you. Ms. Gressler, a 2018 poll conducted by the Cato Institute asked workers to rank policies that best help balance work and family. Results indicate that workers value flexible work schedules and ability to work remotely or by telework, as you've indicated. Does the Family Act's prescriptive mandate provide workers with the workplace flexibility they value? What policy options should this committee consider that would better meet these preferences?
I think the Family Act would limit flexibility. As I mentioned before, it doesn't provide that option for workers to do some work while they're on leave. And there are better policies out there. There's the Working Families Flexibility Act that allows those lower wage workers to accumulate paid time off. An important thing also would be to clarify the definition of who's an employee. Contract workers, gig economy workers, independent workers, they have more flexibility and autonomy, and they are the people that are choosing these type of options, and yet instead of taking those options away, we could clarify it so that they know that they can choose that and they can schedule ahead their hours. There are also some things that would just let people have more control over their options and freeing up resources as well. The Tax Cuts and Jobs Act, that ended up with more companies coming out with paid family leave policies.
Well, you indicated a little while ago that the FMLA could create problems where if you expand this tremendously, that there could be unintended consequences. Would you like to say a little more about what the consequences of leaving ill-defined legislative text open to interpretation?
Yeah, I think the unintended consequences is that we don't help the people that we really want to, and we don't let employers have the discretion to be able to say, I want to help you with this need. Instead, we have these one-size-fits-all policies, and the broader you make them, the more people they encompass, and it won't happen everywhere, but it does happen at workplaces where you have 45% of workers who have an FMLA certification, and they have the option to take leave whenever they want it. That's really unworkable for employers, and that's under the current definition. The more we expand it, the more workers out there who will have these certifications as kind of a hall pass to just check in and out when they want to. And that's not what policymakers intend for this to be.
Thank you, Madam Chair. I yield back.
Thank you very much, lady from Pennsylvania. Ms. Wow, you recognize 5 minutes.
Thank you, Madam Chair. I have to say as a general statement to everybody here that flexible work schedules, telework, generous leave policies are wonderful, but what of the workers who don't happen to have those benevolent employers? That's That's where my real concern lies, and that's where I think most of our concern should lie. In a country that touts the importance of family values, I am consistently amazed at how unfamily-friendly our laws are. I agree, Ms. Gressler, that it would be lovely if all employers were willing to work with their employees and afford them leave as needed. But we haven't seen that actually happen in the workplace for most workers. And we know that countries that have better family leave policies have lower infant and maternal mortality rates, better educational outcomes, and their citizens overall report higher levels of happiness. I think there's a direct correlation when we really do act in a way that is family-friendly and it affords people the ability to take care of their family members, all of their family members, in addition to working. You seem to have, Ms. Gressler, a very negative view of employees who use FMLA. You referred to a get-out-of-jail card-free, the Friday, Monday Leave Act. I reject the notion that most employees who avail themselves of FMLA are acting in bad faith. Is it your opinion that most people who use FMLA are acting in bad faith?
Absolutely not. And I tried to highlight the fact that this is not every instance. This is a narrow subset, but I think that you tend to get certain workplace environments where it becomes an entitlement and people learn what they can do and they use it in ways that were never intended.
So an easy way of putting it is that the few bad apples will ruin it for all, right?
I think few bad apples will make things difficult for employers and they will prevent more flexible policies for the workers who otherwise want and need them.
Before I go any further, I want to ask unanimous consent to include the written testimony of Barry Kluger and Kelly Farley in support of the Parental Bereavement Act into the record. Madam Chair?
Without objection.
Thank you. Just didn't want to forget to do that. Ms. Gressler, your written testimony says, and I quote, "I also believe that flexibility should be an earned privilege, not a universal right." My question to you is the message that to a really good worker that's been with a company of, say, only 15 employees for a decade, who finds himself or herself in desperate need of accommodation to take care of a family member who is ill or of his or her own health needs, that they haven't earned the coverage or flexibility that FMLA affords to other workers who might happen to work for an employer with 50 or more employees?
By saying that I think that workers should be able to earn that flexibility, what I mean is that it should be at the discretion of the employer. There are some positions, and there are also some workers who are more conducive to being able to work remotely or to have more flexible hours, and it needs to be at the discretion of that employer to be able to determine that. When you have small family businesses, it's difficult to have a one-size-fits-all policy because that doesn't actually meet everybody's needs. When you can have more flexible and accommodating policies is when you can meet all those needs.
But we know that not every employer will act in good faith. Isn't that true?
Yes.
And we know that not every employer will act in the best interests of their employees. And sometimes it is necessary to impose broader rules, broader regulations to make sure that employees are treated fairly. Fair enough?
I agree, but I think it's a really hard thing to legislate intentions and to legislate employers to have good hearts. The alternative is for us to encourage them to do the right thing, but you can't force people to do something. The best thing is for workers to have options and opportunities so that if they're in that bad situation, they have another job to go to and they have a higher ladder that they can climb up.
Let me just stop you there because my time is running out. Let me suggest to you that a really hard thing is when somebody has just suffered the loss of a child or somebody has a very sick child and isn't able to take time off from work because they work perhaps for an employer who has 15 employees or not 50 or more. That, I would submit to you, is a really difficult thing, not much more difficult than the employer who might have to accommodate an employee who is in need of FMLA. With that, I yield back.
Thank you very much, Mr. Takano. You're recognized 5 minutes, sir.
Thank you, Chairwoman Adams, for this very important hearing on the need to enhance protections under the Family Medical Leave Act, otherwise known as FMLA. We need to ensure that the conversation about paid family leave includes robust wage replacement. expanded protections to allow more workers to qualify, and more importantly, an assurance of job protection without penalty if someone decides to take leave. According to a December 2019 report by Pew that looked at 41 countries, the United States was the only country that did not have a federal paid family leave program. Countries like Japan, Norway, and Austria all offer over 1 year of paid family leave for their workers. Why has the United States, a global leader, been so slow to follow in their footsteps? Dr. Jacobs, I understand that there are different variations on paid family proposals across the United States at the state level and in other developed countries. What are the components of the European models that allows those countries to have thriving economies and guarantee job security for their workers?
So I should start by saying that I'm not an expert on the international policies, but I can say a little bit about the components of the policies that I know of that have been borrowed by the states and that we see working here in the U.S., and that in turn kind of add up to the backbone of what the Family Act is, the act here. So why don't I start by just describing the Family Act, which is very similar in some ways to what we have in the states. It's an earned benefit. It would provide 66% wage replacement to individuals who would be able to earn that over time. It would provide up to 12 weeks of 66% wage replacement for their own serious health condition, including pregnancy and childbirth recovery, so maternity leave, as well as paternity leave, as well as leave for the serious health condition of a child, a parent, a spouse, a domestic partner, the birth or adoption of a child, and for particular military caregiving and leave purposes. It would cover workers in all companies. This is similar to what many European countries have done as well by having a social insurance program that means that it's funded by a very small payroll contribution from employees and employers. It means that it travels with the worker, so it doesn't actually matter what company you're with. You as an individual who's been working earns this benefit, and when you need leave, if it's for the happy event of the birth of a child or for the very sad event of having to take care of a dying parent and everything in between, that earned benefit is there for you. And then finally, like many European countries that have done this in the past, much like our Social Security system, it would be administered by a new Office of Paid Family Medical Leave. And so we'd take advantage of some existing federal systems and not have to reinvent the wheel, which is something that states are having to do as they try and borrow pieces of this model and have really shown us that it works. They're doing it, we have 7 states plus who are trying to do that on their own, rather than replicating it over and over and over again in each state and creating this patchwork that workers and employers have to navigate. We have the potential to do it at a federal level and really simplify things and add some more dynamism to the workforce that we risk kind of squashing if we keep on doing it the way we've been going.
Well, thank you very much for that very thorough answer. Mr. Sandkamp, there's been a bit of discussion about the loss of flexibility for employees and employers if we adopt a federal paid leave program. As a small business owner, have your employees experienced any loss in flexibility?
Thank you for the question. Meaning a loss in flexibility on my employees' behalf?
Yes. Yeah.
I'm not seeing that, no. We've been in New Jersey, we've had a Family Leave Act in place for about 10 years, and it's been all positive. My employees love it. Last year, the deduction was about $34. So while some people claim it to be something that's going to, blow up and become something really, unsustainable or be a Social Security type deduction, it's $34 is not that for the year. It's less than a cup of coffee every 2 weeks.
Well, did you experience high turnover rates when the law went into effect and you started offering paid leave?
I'm sorry.
Did you experience high turnover rates when the law went into effect and you started offering paid leave?
Right. I had more turnover prior. When the law went into effect, now I retain employees, and it's been net positive. I'm able to have a benefit that an employee can feel less anxiety about what's going to happen when they have a problem in their family, and they can feel like that benefit is there for them. And being a small employer of less than 10 employees, I don't get cherry-picked by a large company that might come in and offer those benefits that I don't have the money to afford.
So I've run out of time. If you could just tell the committee, for the record, if the New Jersey law has had any impact on your ability to remain competitive in your industry. But my time is right. I have to yield back. Thank you.
Would it be possible for me to add a few things? I have a couple points that are directly relevant.
Chair recognizes Mr. Schneider from Illinois.
I'll use some moment. First, let me say thank you, then I'm going to come back to you, Dr. Jacobs. But I want to thank the chairwoman for having this committee. I want to thank the witnesses for being here and sharing your perspectives. And importantly, I want to thank the subcommittee for allowing me to join you. This is not my traditional committee. Dr. Jacobs, you had a couple points you wanted to make real quickly.
I just thought I would add, because we've heard some anecdotes and we have very compelling information from Mr. Sandkamp about the consequences for business, but we also do have some representative surveys and published research on the consequences of the paid leave programs in Rhode Island and in California on business. So I just thought it would be useful to have
If you want to
have
share
some of
those, I'll
statistics.
submit them for the record.
Okay.
That's okay.
Yeah, they're in my written testimony as well.
And Mr. Sandkamp, again, real briefly, I want to follow up what my colleague, Mr. Takano, was talking about. How has your culture changed since the new law has been in place? You talked about your turnover is down, which would be a reflection. How has it changed?
Well, I find that if an employee thinks that I have I'm doing something for them that's helping them, they're going to also want to have that same kind of feeling about my business.
And you haven't had a sense that, oh boy, they now can take advantage of you. I'm going to guess it's a culture of we're in this together and we're going to make sure we back each other up but help each other succeed.
Yeah, and especially in a small business, less than 10 employees, you get to know each other very well. And I think that my employees tend to have more care from my business because they feel that same thing coming from me.
And my experience was similar, that's why I asked that. But I want to expand on that because the emphasis is that this offering paid leave is a smart decision, a business decision. It reduces employee turnover and increases employee retention. I think it can change the culture of a company, as has been laid out. Now, I introduced legislation that would provide this much needed protective leave to workers following every parent's worst nightmare, the death of the child. My colleague, Mrs. Wild, had introduced that. The Sarah Grace Farley Kluger Act is named after the brave families who lost children and have been tireless advocates for this cause, and their experience illustrates how critically important it is for parents to have protected leave after losing a child. Barry Kluger, who lost his daughter Erica in 2001, says in his testimony submitted for the record, new parents are given 12 weeks of unpaid leave under FMLA, but most employers only give their workers 3 or 5 days, up to 5 days, to grieve. Imagine receiving the most earth-shattering news, having to bury your child, and then returning to work only a few days later. And that's for those lucky enough to work for employers who provide even that minimal leave. According to the National Academy of Sciences, the death of a child is one of the greatest and often most enduring stresses a parent can experience. No parent should see their child be lowered into the ground. Kelly Farley's experience speaks to how vitally important this protected time is for grieving families. He and his wife lost both his daughter and their son in the course of 2 years. When his daughter Katie died, he dove right back into his work. He said that, and I quote, "I thought that was expected of me as a dad, but on the inside I was screaming in pain." To this day, Kelly describes the decision to go right back to work as one of the biggest mistakes of his life. 18 months later, Kelly lost his son Noah. This time he and his wife took off 3 months to start the grieving process. Having time allowed them to begin to heal and to get the support they needed, Kelly says it literally saved the couple from a complete emotional breakdown. Kelly and his wife were fortunate enough to have employers who were understanding, but it's not the case for every one of the estimated 20 million parents who have lost a child. By age 60, nearly 10% of parents have experienced the death of a child. Illinois, my state, is one of 2 states that has passed protected work leave for grieving parents. My bill would allow workers nationally to take up to 12 weeks of protected leave. I appreciate our witnesses for highlighting the incredibly important reasons why we need national paid leave. Research shows, and stories like Barry and Kelly's demonstrate, how important it is to include bereavement within FMLA. Dr. Jacobs, in your testimony, you also touch on the big impact leave has on the health and well-being of new mothers and fathers. With the few seconds we have left, could you expand on how federal leave laws provide leave circumstances like bereavement, in the case we talked about, how the federal laws don't have that for critical health and well-being of working families?
So I can't speak specifically to the impact of bereavement leave on health outcomes for families. I can say, as the mother of 2 children, the idea of having to go back to work immediately after losing a child is breathtaking, and so I can only imagine. A few things that I can say based on the data. First of all, we know there are demographic differences in terms of child mortality, so minority families are much more likely to experience the loss of a child. So I'll say that there's a demographic dimension to this as well. And the second thing I'll say is that we know that the opioid crisis has expanded the range of the kinds of families who are losing children. This isn't just about young children, it's also about parents losing older adult children. And so I think when we think about bereavement and who this impacts and the ripple effects it's having on the labor market, that it's important to actually take a step back and think bigger, and I'm very happy to have mentioned that.
Steal 2 more seconds. I spoke to a constituent yesterday about other issues, but she shared that she's raising her 9-year-old grandson because her 28-year-old son died of opioid overdose, and the child's mother died a year after that. So this is something we're seeing across our country, and it does not discriminate. Thank you. I yield back.
Thank you very much. Ms. Porter from California, 5 minutes, ma'am.
Thank you very much to the committee for allowing me to join here today. This is also not my usual committee, but I am the first single mother of young children to ever serve in the United States Congress, and paid family leave and paid medical leave made it possible for me to stay in my career, and so this is something I care a great deal about. Dr. Jacobs, the FMLA has a provision often referred to as the marriage penalty. Could you explain this provision and how it works?
Yes. So the marriage penalty is a stipulation in the FMLA that if you have 2 partners, spouses who work for the same employer, they can't both take their 12 weeks of FMLA protected leave, assuming they work for a covered employer and they're eligible. They have to decide that either one parent will take that, or one of the workers will take it, or that they'll split it. So compared to another working family where you have a couple where one works for one employer, one works for another employer, if they're both covered and eligible, they would have a total of 24 weeks of leave, which, if you can imagine, for the birth of a child, for taking care of an aging parent or an in-law, it's really useful to have that time. Many of these conditions really do require more than 12 weeks. But if you happen to be with a partner who works for your same employer, that marriage penalty means that that protection isn't available to you.
And is it also correct that if an unmarried couple were to be expecting a baby, they could each claim 12 weeks, but if they were a married couple, they would be unable to do so? Hence, this is a penalty for couples that give birth while married.
That's correct.
Okay. And is there any research on when you have this situation where the couple must split, divide the 12 weeks between the 2 of them? Let's say it's a man and a woman couple. Is there any evidence on how that divides along gender lines if it is a heterosexual man-woman couple?
The evidence suggests that because women are typically paid less than men, not always, obviously, but on average, that's what happens in a couple. And if a household is making an economic calculation based on a household budget, and you have to choose who's going to take the leave, it often ends up being the economically rational. I'm putting that in scare quotes because we all know that rational varies a lot depending on your situation, but from a household budget perspective, it ends up making the most sense for the woman to be the one who takes the leave, which in turn perpetuates exactly the gender wage gap, because you have a woman who in many cases is out of the labor force. If it's not a paid leave, if it's not a job-protected leave, she may stay out of the labor force, and in turn, when she's ready to come back, she may actually earn less.
Yeah, and then that's on top of the physical effects of giving birth, as well as the responsibilities of breastfeeding and nursing in the workplace, which is a challenge for many women that men don't face after they give birth. In November, I introduced the Bipartisan Fair Leave Act. It's HR 5075. It would eliminate this marriage penalty so that married couples would not have to split their leave and choose, which often means that the woman is the one taking the leave, rather than a balanced approach. With the FAIR Act, each parent would get 12 weeks of FMLA leave, regardless of whether they worked for the same employer or a different employer. So I would, Ms. Representative Batch, I know you took time off. Would this kind of, would the ability to have had to choose affected your ability to, if you had to share your unpaid leave, how would that have affected your ability to recover from cancer treatment?
Absolutely. Actually, so my husband is my law partner, and so this actually does affect us directly. And so he went back to work after the births of both of my sons, and then also right after both of my surgeries and through my radiation treatment, because he didn't have the ability to just be able to take off when I was home. And so that actually directly affects me. If we had paid leave, and especially being a small business owner, then we would have been able to actually balance our budget better, and he would have been able to bond with our children instead of returning work immediately. And so I think it's absolutely essential, and I think that your amendment, or your bill, I'm sorry, is definitely one that everyone should support, because you shouldn't be penalized for simply being married.
With my remaining time, I just wanted to ask Ms. Gressler, I am struggling to understand your testimony on page 5 that you've made reference to. You're making claims of data that you are saying shows the misuse of FMLA leave, and you're citing the study particularly of the MBTA. But all that study really shows is that that women took more FMLA leave than men, and therefore there is a gender pay gap. But wouldn't we expect, given the nature and the historical structural barriers, that we wouldn't expect women to take more leave than men? How is that evidence of misuse?
Yeah, the fact that women took more leave is what contributed to the wage gap. The evidence of the misuse happened when you looked at, well, first of all, they hired a company to come in and to try and more appropriately regulate the FMLA and make sure it was properly certified and properly used. And you saw their certifications drop from 45% of workers to 27% of workers. And then you also saw the amount of leave that was taken drop by 27 and 28% for men and women. And there were also statistics there looking at just the differences in leave taken if it's a holiday week or a weekend week, and you see spikes, both men and women, if it's a Monday, Friday surrounding a weekend, and if it's a week that they were assigned a holiday shift.
My time has expired, but that seems utterly consistent to me with needing to cover medical care and child care when I'm assigned to an unusual shift.
Thank you very much. Thank you to all of the witnesses. I want to remind my colleagues that pursuant to committee practice, materials for submission to the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing, preferably in Microsoft Word format. The materials submitted must address the subject matter of the hearing. Only a member of the committee or an invited witness may submit materials for inclusion in the hearing record. Documents are limited to 50 pages. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within required time frame. But please recognize that years from now, that link may no longer work. Again, I want to thank all of the witnesses for their participation today. What we've heard is very valuable. Members of the committee may have some additional questions for you, and we ask the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. I now recognize the distinguished ranking member for his closing statement.
Madam Chair, I just want to echo your comments and thank the witnesses for being here, and agree with you that it was a very interesting hearing on an important issue. I yield back.
Thank you. I recognize myself for the purpose of making my closing statement. Thank you again to the witnesses for sharing your experiences and expertise with us. We heard compelling testimony on the need for Congress to build upon the successes of the Family and Medical Leave Act to ensure that workers have the right to take job-protected time off to care for themselves and their families. We also heard compelling testimony on the imperative for a national, comprehensive, job-protected paid family and medical leave program. And we must update the Family and Medical Leave Act to not only provide FMLA eligibility for all workers, but also to expand the permissible reasons for which workers can take job-protected leave. At the same time, Congress must pass the Family Act so that workers do not have to risk their financial security in order to care for themselves and their families. If we work together to achieve these combined efforts, we can improve the health of families and children, we can improve employee retention for our nation's businesses, and we can put millions of dollars of income back into the economy, into workers' pockets. More importantly, though, we can ensure that all Americans have the right to sustain their livelihoods while giving themselves and their loved ones the care that they need to thrive. I ask you unanimous consent to enter into the record a letter from the National Partnership for Women and Families, whose advocacy was critical in passing the FMLA. And without objection, so ordered. If there's no further business before the committee, without objection, the subcommittee stands adjourned.